Hey everyone, Dr. D here. All right, so Johnson Johnson has released its information to the FDA, going through the process right now of approval and recommendation by the CDC. But before we get to all of that, let's break it down and find out what's going on with the Johnson Johnson vaccine. Okay, so first let's talk about what the actual vaccine is. Okay, the Johnson Johnson vaccine is a viral vector vaccine. What does that mean? All right, so take a look. Look at this. So here you have a picture of the adenovirus, okay? An adenovirus, it's got, its cell membrane, it's got its version of little, we call them spikes, right, on the outside. But basically, it also has its DNA. Now, it thinks it has its DNA that encodes for more versions of itself. But we've basically taken that adenovirus, we've kind of tricked it, we've pulled out all of its normal DNA, and then we've given it basically a vector that has the DNA that codes for the spike protein. So it thinks it's going to go and infect a cell. So here you see the virus binding to the cell, all right? It thinks it's party time. It jumps inside, and it's got its inside of its little bubble. It makes its way over to the nucleus, and then it injects DNA. It thinks it's injecting its own DNA, but actually it's injecting what we call a vector that encodes for the spike protein. So that's a vector, it's DNA, it's double-stranded. That double-stranded DNA is then changed to RNA. And now what do you see? Very similar to what we see from the RNA vaccines. That RNA then leaves the nucleus, goes out into the cytoplasm, and what does it do? So here you see where the RNA is translated into spike protein. And remember, spike protein is 3 different proteins, 3 different versions of itself. They come together, and then that spike protein has a number of different fates. Some of the spike protein doesn't fold correctly, so it gets destroyed and it gets presented on the cell surface, as you can see right over here. All right, there's a little small fragment of the spike protein. But some of the spike protein gets created normally, gets processed, and it goes and it basically shows itself on the outside of the cell surface. That then leads to what we call T cells, all right? T cells come along, they see that this cell is having proteins on the outside it should not have, it triggers it for destruction. So you get T cell destruction, you end up with small debris from the dead cell. That debris now gets, remember we talked about before, what is this? This is our macrophages, this is our Pac-Man. The macrophage goes, it engulfs the spike protein, chops it up, and then displays versions of it on its cell surface, okay? So one of the fates that can happen from here is that what we call antigen-presenting cell, or macrophage, is now presenting chopped up pieces of this spike protein on its surface. It can interact with activated, we call killer T cells. And those killer T cells can go and find other virally infected cells that have pieces of this spike protein on its surface. It can destroy them. But it can also do what you see here. It can basically go and interact with helper T cells. Those helper T cells can then interact with B cells, and then those B cells have a couple of different fates. They can basically either go down the lineage of becoming what we call memory B cells, or they can go down the lineage of becoming what we call differentiate into plasma cells. Plasma cells produce antibodies, and what do antibodies do? Antibodies go and they can then bind to either virus that's ever out there. So that's our neutralizing antibodies, right? Those plasma cells can now produce antibodies. Those antibodies will go out, they can bind to spike protein that's out in the form of the virus, okay, and neutralize it and prepare it to basically get destroyed by the immune system. Okay, so now you know everything you need to know about the Johnson & Johnson viral vector vaccine. So now let's get into the actual trial and talk about what some of the terms were, what were they looking for, what were the endpoints, who was involved, and what were the results. Okay, so first let's talk about who was in the trial, okay? So one of the great things about this trial is that the trial incorporated individuals in 3 different geographical regions, right? So you've got Latin America, you've got North America, basically the USA, and then you also have South Africa, okay? Now that's very important. Why? Because in Latin America, you've got Brazil, where you've got this new Brazil variant. South Africa, you've got the South African variant, and then you can look in the US and see the versions that are going around the US and how effective is this in the US. The next thing you see is it has a nice distribution in regards to race, in regards to ethnicity, in regards to male, female, etc. So So that's something that you want in any clinical trial. The next thing we see is that you have a very, very good list of diversity in regards to pre-existing conditions. So people ask me all the time, like, Dr. D, what if I have this? Can I take the vaccine? What if I have this? I got high blood pressure. I got asthma. I had pneumonia last year, right? So you have people that have all of these different things, and they're like, what about that? So here, let's take a look. You can see this, where they basically go through and show you all of the different pre-existing conditions that individuals have that enrolled in this trial: asthma, cancer, COPD, HIV, sickle cell, diabetes, etc. Beautiful. Okay, so now let's define the terms. Very, very important. You guys know I'm a big stickler about this, okay? You have to separate these terms. Asymptomatic SARS-CoV-2 infection, and then you can have mild COVID-19, moderate COVID-19, severe COVID-19. And so for this trial, some of the numbers you hear are all over the place because they kind of reported the data a little bit different, okay? So they reported the data. There wasn't a lot of individuals that had what we would call clinically defined mild COVID-19. And so most of the individuals pretty much fell into either moderate, severe, or severe critical. Okay, so first, what is moderate/severe COVID-19? So moderate/severe COVID-19 is going to be what they define as an individual that has PCR confirmed SARS-CoV-2 infection plus, and then you can see here, they either have one of these on this side of the column, okay? So either, elevated respiratory rate, abnormal saturation of oxygen, but greater than 93%, radiologic evidence of a DVT, etc. You can have one of those, or you can have two of these other symptoms, okay? So fever greater than 104 plus heart rate greater than 90, shaking chills, sore throat, cough, etc. Okay, so you look at these and you say, okay, so individual that has either one of this column or two of these column will fit the definition of what they call moderate to severe COVID-19. The next thing they looked at and they basically defined was what is severe to critical COVID-19. So once again, take a look at this. So severe critical COVID-19 includes SARS-CoV-2 positive patient, again, confirmed via PCR, plus any of the following at any time during the course of observation. So that's going to be, again, these really, really, really severe symptoms. Heart rate greater than 125, respiratory rate greater than 30, oxygen criteria in terms of really, really, really low partial pressure of oxygen. Or here, evidence of shock, which they define as a blood pressure less than 90 or diastolic blood pressure less than 60, anyone requiring vasopressors. Renal disease, hepatic disease, neurological disease. You guys hear me talking about this all the time. Admission to the ICU or death. So these are the qualifications for severe to critical COVID-19. And just for the purposes of being thorough, I'll show you what they defined as mild COVID-19. Again, they don't report data for mild COVID-19 because it just wasn't enough individuals that actually met that criteria. But here we go. This is what they defined as mild COVID-19. So an individual that had a positive SARS-CoV-2 PCR test, plus only one of the following. And any of y'all that had COVID-19, y'all know it's very rare to only get one of these. So that's like, a fever, sore throat, malaise, etc. You can only have one of them. So by their definition, didn't really have a whole lot of people that met the criteria for mild COVID-19. Now let's get into the results. Okay, so now for the fun part, right? Where you hear all of these numbers and all of these percentages, okay? So here, you can take a look at this, and this is basically directly from the data that was submitted to the FDA. It looks confusing, right? Basically, what you're looking at is they're looking at a comparison of individuals that were given the vaccine versus was given the placebo, and they're looking at it at 14 days and at 28 days, and then they're looking at what was the efficacy at reducing moderate to severe versus severe critical COVID-19, and then they're breaking it down by either United States, South Africa, and Brazil. Now, I basically took all of that and I created this for you. And so this is much, much easier to follow. You can basically take a look at this, and this is how it breaks it down. So again, they took a look, they wanted to observe, okay, what happened, how early are you starting to get protection, okay? And then if you, and we all know it takes like 2 weeks to get antibodies. So you don't really expect to get any real protection until about 2 weeks. So they took observations at after 14 days, so basically between 14 and 28 days, and then observations after 28 days, okay? And so what you see, once again, didn't have a lot of people that met criteria for mild, but they had a number of individuals that broke down into how well did this protect against moderate severe versus severe critical. And so what I have in the darkened numbers here at the top is basically overall. So that's like a combination of all of the different areas. But then they further broke that down to what did they see in South Africa, what did they see in USA, what did they see in Brazil, and that's why you're seeing all of these numbers. I know it's confusing, it's a lot of information. But basically, if we stay at the first part, the efficacy at 14 days overall for reducing moderate severe COVID-19 was 67%, and then after 28 days, 66%. In South Africa, for moderate severe COVID-19 reduction, it was 52% efficacy in South Africa at 14 days, 64% efficacy at 28 days. In the USA, 74% at 14 days, 72% at 28 days. You see so on and so forth. So take this, screenshot this. I'm going to give you a chance to screenshot it. Okay, cool. And now you can go back and you can take a look at this and break it down further. Now let's move to severe and critical. So severe critical, how well did this vaccine protect against severe critical COVID-19? So overall, 76% efficacious at preventing severe critical COVID-19 after 14 days, 85% after 28 days. And then you look at South Africa, you can break it down, South Africa, USA, Brazil. So that's why you're hearing all of these numbers and all of these different percentages. The last part they looked at is basically say, now think about this. All right. So think about the Moderna trial. The Moderna trial was 2 vaccine doses separated by 28 days. And let's say you give another 14 days after the 28 days. What do you got? 42 days, right? Pfizer trial, 2 doses separated by 21 days. 14 days later, you got 35 days. So how well does this prevent how does this vaccine overall prevent severe COVID-19 if you move and you only look at individuals after 42 days? Why? Because that's when we know you've got your full arsenal. The only thing that you get from those earlier days, 14 days, 28 days, is to just see how well it works, how early. But if we're going to be fair and we give it 42 days to work, which is what we give the 2 doses of Moderna, what do we see? Look at that. 92% efficacious at reducing severe COVID-19 after if you give it up to 42 days. And that's across all sites. So that's wonderful, wonderful information. But what really matters? What matters is if I take this vaccine, am I going to end up in the hospital and am I going to end up dying? And so that's why I created this for you to just remind you that this Johnson & Johnson vaccine basically showed 100% efficacy at preventing hospitalization and death from COVID-19. That is what we really want from a vaccine. Can the vaccine prevent us from getting really sick, and can it prevent us from dying? And that's what this vaccine does. I presented all the data. Take it, stop it, rewind it, take screenshots. But this Johnson & Johnson vaccine, there's a reason that basically got unanimous approval by the FDA. It's a very good vaccine. It shows how early it starts to protect, is what this data shows. It shows that, again, after 42 days, it's very efficacious, and at preventing hospitalization and death, it's 100% efficacious. So this is a phenomenal vaccine, and the reason it's so good is because it can be stored for months at refrigerated temperatures, right? Which is phenomenal. That means we can get it out into neighborhoods where we normally wouldn't be able to get the others that require -20 for a while, okay? You can get it out to rural areas, okay? So areas where you only got about 10 people in the county, right? You can get it out to those areas. Or you can actually go and target individuals that are in vulnerable populations. You can say, hey, you know what? A lot of African Americans, they're in, what do they go to? Hey, they might not show up to the hospital, but you know where they go? They go to the barbershop. You know what I'm saying? You see my hair? They go to the barbershop. They might go to the beauty salon. Let's get it and target those doses at areas like that. Or let's go do a church drive. There are a lot of people who go to church of all backgrounds. Let's see if we can start pushing it and giving vaccines at churches. So those are ways that those are things that we can do more easily with this Johnson & Johnson vaccine that you just cannot do with the other vaccines. So wonderful vaccine. It meets my approval. I hope it meets your approval also. All right, take care.